Hi everybody, come hop on with me, say hello. If you are catching this on YouTube or catching it on the replay and you have no sweet clue who I am, my name is Ashley Bully. I'm a full-time professor of nursing and you are tuning into N-Powerment Nursing. Or if you're catching this on the Facebook page, hello. So excited to talk to you guys. We are going to be talking about test day. So, you're ready? You think you're ready? Are you ever going to feel completely ready? Who can answer that question for me? Are you ever going to feel 100% completely ready to write your registration exam? Be that the NCLEX, NCLEX-PN, CPNRE, whatever exam. Will you ever feel 100% confident ready? No. Nope. You're always going to be like, oh, I don't know if I'm ready. Okay, so prepare yourself for those types of feelings. You will have those feelings. Those feelings are normal, okay? It's normal for you to feel like, I don't know if I'm ready. But if you're having like massive anxiety and you need the reassurance of somebody else to tell you you're ready, you're probably not ready to write, okay? You need to feel like you've done absolutely everything you can, and at this point, there's nothing more you could do to prepare. Now, a few things about test day. You could study for 30 years, okay, and still come across a question that you don't know the answer to. It's going to happen. It's bound to happen. You need to prepare yourself for what you're going to do when that happens, okay? I knew when I went into my NCLEX exam that there was very little that was going to get me in terms of content. Super solid in my content. I was ready. I studied. I knew my stuff. I knew what was going to happen to me is that the second I got like a medication that I didn't recognize, I'd freak out. So I was going to have that, oh, I should have studied longer. Oh, I should know this. Oh, I should have done more. I should have, okay? Prepare yourself for the moment when you're sitting in the chair, writing your registration exam, and you're going to have that moment where you don't recognize the name of something or something's unfamiliar. It's going to happen. You don't have to get every question right. It's okay. It's okay. Let it go. Let it go. Let me see if I can see better with my glasses on. No. Negative. Okay? So prepare yourself for that moment. Here's some recommendation suggestions for test day, the actual day of testing. Do you have a game plan? Do you have a game plan for test day? You need to have a game plan for test day, all right? You don't want to not know where the location is of your exam. You don't want to be finding it for the first time the morning of when you're writing at 8 o'clock in the morning and your stress level is already high, all right? You need to be familiar with the location, close to the location, okay? You need to know what you're going to do in the morning, whatever time it is you're writing, you need to have a game plan for test day. I have a few suggestions, highly recommended suggestions based on our experience with thousands of individuals that have written the registration exam, okay? Recommendation number 1, do not go write your test with a friend, okay? Why? I don't know about you, but my study buddy in my undergraduate degree wrote her tests in half an hour. I was always the last person leaving the room. So if you go and write your test with a friend and your friend gets up and leaves 30 minutes after they start writing and you're there for another 4 hours, what's going to be going through your head? Oh, I must be failing. Oh, they're probably waiting for me in the car. Oh, I'm so stupid. Oh, they did better than me in school. They finished in 45 minutes. Oh, wait, I did better than them in school. I can't believe they're done in 45 minutes and I'm still here. Maybe they failed, right? Your mind's just going to start wandering. Do not go write your exam with a friend. Don't. You go and write your exam by yourself, okay? By yourself. You maybe don't even want to tell other people you're writing the test, the exam. Why? Because then you have this added pressure, right? There's something that is like stuck to my mouth. I don't know. You might have this added pressure of like, oh, they're going to call me and ask me how it went, or, oh, you know, they're expecting me to pass. I feel all this pressure. It's all on, like, my family's future is all on my shoulders, right? So maybe you don't want to tell people. Maybe you don't want people to know you're writing. You don't have to tell people you're writing your registration exam. They don't need to know. So those two things. Don't write it with a friend. Do not write it with a friend. Okay? We've given that recommendation to people before, and then we hear back from them and they're like, yeah, you're right. I shouldn't have written it with my friend. Yeah, we know. Do not write it with a friend. The only exception to this is if you went to school with a twin and you have a twin who's writing the same day. Then we're like, well, you guys are twins, right? You're in the womb together. Go write your exam together. It's okay. All right? Do not write it with a friend. You may or may not want to tell people that you're writing it. That's the second thing. Here's the third thing. What you say to yourself and how you treat yourself the day before and the day of writing that exam will massively determine your success. Okay? Here's something we know that you don't know that you need, but we know you need it. Okay? It's called emotional readiness. You can study all the content in the universe. Okay? You can know every textbook there is to know about nursing. You can know absolutely everything. But if you go into that exam scared, and you sit in that chair scared, and you get a question you don't immediately know the answer to, and you freak out, how you treat yourself and what you say to yourself is going to determine whether or not you pass or fail that exam. It doesn't matter how long you studied for. I can promise you. This is why straight A students fail the registration exam, okay? It's because straight A students are used to studying inside out, upside down, and backwards, everything and anything, and they know absolutely all the possible questions they could possibly be asked, and they know all the answers to them, right? That was me, straight A student. I knew going into my NCLEX exam, there's like no more I could have studied. I opted out of cranial nerves because I was just like, really? No. That's the one thing I opted out of. I was like, no, I'm not going there. I made that conscious decision. If I'm asked them, fine, whatever. I know like 4 of them. That's all I'm doing. Just wasn't a fan of cranial nerves, if I'm being honest. Okay. So, I opted out of that. That was my decision. But I knew, okay, that I would freak out because I'm a perfectionist. I studied, overstudied, studied to perfection, straight A student, academic perfection. The NCLEX was unknown. It's the unknown that freaked me out. I would have rather somebody said to me, here's 10,000 pages. You need to know everything in those 10,000 pages. I would have known them. I'm telling you, I would have known them all. It was the not knowing, okay? The good news is we know what you need to know. We know the must-know content. We've packaged it for you. We've done all of the work for you. You don't need to ask yourself those questions, okay? Is it enough? Yes, absolutely. Will there still be critical thinking required? Yes, absolutely. What are you going to say to yourself when you get a medication you've never heard of, okay? I knew that would happen, and I prepared for that. So I thought, I'm going to have a plan because I'm going to freak out if I don't know the answer to something. I'm going to freak right out. I always know the answer. And I'm not saying that in an arrogant way. I'm saying that in a perfectionist, overstudied way, okay? So I decided before I walked into that exam that if a question came up and I was like, that doesn't end in LOL or idine or adol or none of the things. Ain't nobody ever heard of that. I decided I was going to laugh and I was going to be like, yeah, we don't have that medication this side of the border. I made that conscious decision that I wasn't going to abandon my ship and I wasn't going to freak out and I wasn't going to let one question nosedive me. I had a plan, and let me tell you, I used that plan because that medication did come up, and, you know, when in doubt, guess urinary output. I was like, ha! I know 10,000 medications, and everything there is to know about these 10,000 medications. Ain't nobody ever heard of that. Laughed it off, moved on, right? Because I planned for that moment. I was ready for that moment. Another thing, when you're walking into that registration exam, you need to be saying positive things to yourself. You need to be in a headspace. So we have this whole walk you through test day, what you need to do on test day. We have a whole preparatory thing for that as a part of our program. Then we have a whole like walking you through the actual exam, things you say to yourself, different strategies you can invoke at different points in the exam. Here's one thing. You need to have that pump up song. I tell you. I hear from students daily that are like, oh, my pump up song was this, blah, 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 blah. It made me feel so much better because it really got me hyped. Whatever your hyped up, good zone, gonna do awesome things music is, that's the song you need. You're probably like, what song did you use, Ashley? I get asked all the time. Okay, so I went to my older brother, who's like, you know, the person who will actually tell you if you look good in an outfit or not. And I was like, okay, I'm writing my registration exam. I need like the best pump up song you can give it to me. And he was like, Eye of the Tiger. I was like, too obvious. Dun, dun, dun. Like, no, I ain't gonna roll up into the NCLEX to that. And then he said Bootylicious. And I was like, really, Bootylicious? No. So I settled on Sail by AWOL Nation, which at the time, it was just a great pump-up song. So that was the song. That was my song. Whatever song it is, let it be a song that makes you feel like I can do anything. I'm telling you, I walked into my registration exam like I was ready to fight a tiger. I was like, bring it. I have arrived. I was so ready. Was I actually confident? Was I actually maybe freaking out inside? Was I actually like, oh, the future of my entire family depends on the next however many questions I get? Of course I was freaking out. I was faking it till I make it. It's called mindfulness, okay? Getting yourself in the zone, saying positive things to yourself, okay? It's purposeful. It is purposeful. Have a plan for what you're going to say to yourself when you don't know the answer to the question. Are you going to laugh it off? Are you going to move on? Okay? Every question matters. There was one question in particular that may or may not have been on my NCLEX exam that I took I wrote my NCLEX exam in 42 minutes. 75 questions, 42 minutes. And one of those questions I spent a good 10 minutes on. It probably felt like 10 minutes, but it was a long time. And that's because I knew that I knew the answer. It was a select all that apply question. We're not allowed to talk about our NCLEX exam, but it may or may not have had something to do with which of the following contributes to cancer or obesity or something like this. And it was something that I learned in second year, but I didn't study. And I was like, I know the answer to this. I got to think this out. And I just sat there and I sat back in my chair and I was like, okay, this one obviously applies. That one obviously applies. That one obviously doesn't apply. But there's always that one that's is that the one they want you to pick because they're trying to make you think you should pick it? Or should you not pick it? There's always that one where you're like, maybe, maybe not. Maybe it's the one they want you to pick, but you shouldn't pick. Maybe you should pick it. It was that one. And I needed to pick it. The context of what that came down to was that morbid obesity causes inflammation, which causes cancer. So there was 4 different levels of knowing things that I had to go to get to that. But I knew I had it. And so I was like, oh, come to me, come to me. I wasn't just gonna oh, I want to get past this question because it's really bothering me that it's not coming to me immediately. So I'm just going to pick this, and go next. No, that's a select all that apply question is. You need to celebrate those, okay? Let's talk about that for a minute. Who hates select all that apply questions? Everybody who sees this is going to raise their hand. Yeah, I get it. They're hard. You need to know all the things about a thing to get it right and all the things that aren't a part of the thing, okay? But why do you need to every time you get a select all that apply questions, it means you're above the passing line. If you don't know how the passing line works, go to our YouTube channel, N-Powerment Nursing, and search NCLEX determines a pass or fail. If you get a select all that apply, say here's the passing line, okay? If you get a select all that apply question, you're above the passing line. You can literally get every other question wrong for the rest of the exam and never go below the passing line and pass. Okay? So if you're getting select all that apply questions, you need to be like, yes, 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 yes. I am rocking this exam. I am kicking booty. Okay? Select all that apply questions, we celebrate. We don't be like, oh, I can't believe I have another one. This is bad. This is bad. I'm going to fail. I never get these right. I never get these right. I'm so bad at select all apply questions. This is awful. No, you get a select all apply question. You be like, yes, I am killing it. Mindfulness, headspace, test day, game plan. Okay? You stay in a positive place. We coach emotional readiness as a part of our program. It's something people don't know they need until they are in it, okay? We hear all the time, even in our live reviews, you know, we know students want to get to the content. The content is fun, it's creative, it's empowering, it's a whole bunch of things that everybody enjoys, and they're like, let's get to the content, let's study, let's get to the textbook, right? All the good stuff. And we're like, oh, wait, you just wait till you're sitting in the chair. When you're sitting in the chair, you're going to know, oh, I'm so glad they spent time on that. I'm so glad they told us to do that. I'm so glad they walked us through the mindfulness of test day. I'm so glad they told us what we should do if we get to question 75, what used to be question 75, and the exam doesn't shut off. I'm so glad they told us what to do when I get the very first question and I've never heard of it. It's called the first question freak out. I'm so glad I was mentally prepared for that. It's not until you're sitting in the chair do you actually know how big of a role emotional readiness plays in your success. It is a good 50% of it. 50% at least, okay? Content, 50%. This. I'm not talking about content. I'm talking about what you're saying to yourself before you write the test, while you're writing the test. 50% easy. And we get messages all the time from individuals saying, oh, you know, when I was doing the mindfulness stuff or when we were doing the emotional readiness stuff, I didn't really get it, but thank you. I'm so glad I watched that video. I'm so glad we spent so much time talking about that because it saved my butt. Because what we call it, we have an analogy for it, did not abandon my ship. Don't abandon your ship, okay? You can do it. You're ready. You're prepared. Own it. Have a plan for test day. If you don't have a test day game plan, you shouldn't be going to test, okay? You need a test day game plan. And I want to know what song you're listening to before you walk into that exam. I actually want you to comment what your song's going to be, okay? Or message me. I want to know what your song is. Maybe we should take a poll. Maybe we should have a song that we recommend. I'll have to work on that. Thank you for hanging out with me. If you're studying with us right now, keep on going. It gets easier every time. It gets better every day. It's a long, exhausting process. The weather's getting nice. You're starting to be like, oh, I kind of don't want to study anymore. I kind of want to just go outside. I get it. I know. It's a temporary place. We're in a temporary study zone. Study boot camp. We're in a temporary place. And one day you'll look back on it and you'll be at the bedside and you'll know things and you'll be so thankful you know them as well as you do. I promise you. We get those messages all the time too. Every day. Every single day. I get messages from people that took the program 3 years ago, 4 years ago, 5 years ago. Oh, I had a patient last night and you wouldn't believe, you know, this kid looked like a strawberry and immediately I knew that it was this. I'm not going to tell and I immediately knew that this is the only person that gets ASA because Kawasaki says ASA written like all the time. The knowledge stays with you and you will save lives with it, okay? You're not just studying to pass. You are studying to save lives, okay? So tell me what your test day game plan is. I want to hear your song, okay? And thank you so much for hanging out with me. If you aren't sure about what our program even is, if you're catching this on the fly, it's coming up on YouTube. Feel free to message us. Our website is www.n-powermentnursing.com, @4empowerment on Instagram, N-Powerment Nursing on YouTube, and of course, if you're joining me here on Facebook, we're all over the place. There is hundreds of you studying with us right now. I'm chatting with lots of you in Messenger, so I'm always here. Have a wonderful, beautiful day. It's super nice outside, at least where we're at. I'm talking to all of, North America and beyond, so who knows if it's a nice day there. If you're catching the replay and you have questions or comments, tell me your song, your test day song. I want to know your test day game plan, okay? You got to have one. Stay awesome, guys. Bye.